Chapter 1, problem. Now, when we talk about problem, we mean the problem that you help with. How does it present to the business? And why? Because the business people are the ones alongside the clinicians who make the decisions for new products to be approved. But number one is why the business? Because frankly, the business is paying for it. The business is paying for your product. Number two, who's the audience? The audience for this are the people who run the business of the operating room, the ICU, the emergency department, the clinic, the health system, the ambulatory surgery center. Not necessarily the people who are asking for your price, the people who run the business. And these are often service line directors, VPs of service lines, perioperative services directors in the OR. So it's that audience, the business people. Why do we focus on the problem so much? Well, if you talk about the problem, it creates urgency. And when you create urgency, people make decisions. Without urgency, this will sit in committee for months. And I actually want you to think about changing your mindset. When you're presenting or when your champions are presenting, think less about how do I get my product approved? This is the mindset part. Think more about how do I get them to understand how bad the problem is and what it's costing the business, not just in dollars, but in some of the other buckets we talk about. We want them understanding the business has a problem. The business, it's costing the business time, money, resources, strategy, whatever. And if they recognize that they have a problem, now they know maybe Copeland's Fetzer valve can help. What was the problem that my product, the fancy surgical instrument, had? Well, surgeons were getting frustrated because the instruments that they currently use were getting jammed in room, stuck with soft tissue, bone in them. These are workhorse instruments. It would infuriate surgeons, and they would have to stop the case and remove the obstruction. Infection prevention doesn't like this, by the way, because that bone that comes from it sometimes is the patient's and sometimes the previous patient's. Sterile processing really struggled to clean these instruments. They're complicated instruments. They get used all the time. They're hard to figure out. And oversight committees are starting to come in. Joint Commission, AAAHC, DNV, Department of Health. And they want to know, how does your sterile processing department and operating room know if these instruments are clean? So the problem that these places had were surgeons were frustrated. It was slowing down their cases, adding cost. It was driving sterile processing crazy because they had to slow down and be very meticulous about these commonly used instruments. Infection prevention was uncomfortable, and oversight risk. If the Joint Commission walked in, they might not like what they see. That was the problem the business had.